Hi, my name is Dustin. I'm a respiratory therapist and a coach. I'm so grateful to talk to you about something that I just learned about recently. So I've moved to Iowa and I've had the opportunity to meet such wonderful people who are farmers, people who work on pig factories, people that are just trying to take care of their families and breathe this beautiful, rich Iowa air. And one thing I never knew is that radon gas is prevalent in Iowa. So I'm going to talk to you about something that doesn't smell, doesn't taste, but it's one of the leading causes of lung cancer in the United States. That is radon gas. So if you live in the Iowa or much of the Midwest, it is especially important because Iowa has some of the highest average indoor radon levels in the country. Let's put health into your hands. What is radon gas? Radon is a naturally occurring radioactive gas. It forms from uranium in the rocks, and soil slowly breaks down over thousands of years. Not as old as dinosaurs, but a long time. So uranium decays and it releases radon gas, which moves through the soil. Normally outdoors, radon quickly mixes with fresh air and becomes harmless because it is so diluted. Now the problem here, if radon enters buildings, it becomes trapped indoors. Why is Iowa such a high risk? Iowa consistently ranks among the states with the highest amount of average indoor radon concentration because glacial soils contain uranium-bearing minerals. Many homes have basements where radon accumulates, and cold winters keep homes sealed for months. Modern energy-efficient homes often exchange less fresh air with the outdoors. The U.S. Environmental Protection Agency estimates that about 7 to 10 homes in Iowa may have radon levels at above the EPA action level of 4. It's 4 picocuries per liter, PCI-liter. Now, where does radon enter my home? Radon usually enters through foundational cracks, the basement floors, crawl spaces, utility pipe openings, floor drains, sump pits, concrete joints. Well water is less common. Even newer homes may have elevated radon levels. Beautiful homes doesn't necessarily mean a safe radon level. Let's go over how it affects your body. Every time you breathe in, air travels through nose, your mouth, your trachea, your bronchioles, and then the alveoli. The alveoli are tiny air sacs where oxygen enters your bloodstream. When radon gas is inhaled, it doesn't usually stay in the lungs for long. The real problem comes from radioactive particles produced as radon decays. These tiny particles attach to dust and smoke in the air. When you breathe them in, they can become trapped inside the lungs. As they continue to decay, they release alpha radiation, which damages the DNA of nearby lung cells. Over many years, repeated DNA damage can increase the risk of lung cancer. So why doesn't radon make me feel sick right away? This surprises many people. Radon usually causes no cough, no wheezing, no shortness of breath, no pain. You can breathe elevated radon levels for years without any symptoms. That is why testing your home is so important. Who is at greatest risk? Your risk increases if you smoke cigarettes, you vape, have lived in the same home for many, many years, have a family history of lung cancer, have occupational lung exposures, live in an area with high radon levels. Smoking and radon together greatly increase the risk of lung cancer compared with either exposure alone. Can radon cause COPD? Current research does not show that radon causes COPD, asthma, or emphysema directly. Its strongest proven health effect is an increased risk of lung cancer, particularly with long-term exposure. So how do I test my home? It's a very simple and inexpensive test. There's a 2-day test, which is around $18. Some websites will even give you a free test in Iowa. The 90-day test is around $30. You give it So the whole purpose of the test is to give you a better picture of the average yearly exposure. Many hardware stores sell radon tests, for example, if you need one, or online. I got mine for free online for my 2-day test. What radon levels is considered high? Well, we talked about it earlier. The EPA recommends taking actions if the average radon level is 4 or higher. So be careful. Now, they also encourage to reduce levels between 2 to 4 because there is no completely risk-free level of radon exposure. Not really. How do we fix high radon levels? It's a great question. The most common solution is called active soil depressurization. Certified radon mitigation contractor installs PVC piping beneath the foundation, a quiet fan, a vent that safely exhausts radon above the roof line. This system prevents radon from entering the home. Many systems reduce indoor radon levels by 80 to 90% when properly installed. What if I've already been exposed? Many patients ask me. Is the damage permanent? Not necessarily. Your lungs have remarkable repair mechanisms. While we cannot erase past radiation exposure, you can reduce future risk by making healthy choices. What can I do now to protect my lungs? Well, first, remove some toxins from your life. If you are smoking or vaping, try to stop as soon as you can. Take these steps each day to transfer your dependence on smoking and vaping to something else. Exercise regularly is very helpful. Do at least 150 minutes of moderate exercise each week. Take opportunities to walk outside and breathe the beautiful fresh air and trees and connect with people. It's amazing how exercise and connection can actually boost your immune system and help you thrive. Eat an antioxidant-rich diet. Eat foods like carrots, tomatoes, spinach, kale, broccoli, berries. Yes, berries are prevalent in Iowa. Citrus fruits, like you would where I'm from in Florida. Sweet potatoes are delicious, high in those rich antioxidants. Bell peppers, beans, nuts, whole grains, lean meats, or whole meat. Fatty fish. These foods help support your body's normal cell repair process. Helpful nutrients you can include is also that can help. Helpful nutrients, supplements that can reverse radon exposure or prevent lung cancer by correcting nutrient deficiencies, support overall health, will be stuff like D3 and K2, omega-3 fatty acids, magnesium glycinate, vitamin C and zinc if you're deficient, and selenium. Adequate dietary protein to support tissue repair is very important. The strongest evidence for lowering radon-related risk remains reducing exposure and avoiding tobacco. Should I get tested? Talk with your healthcare provider if you have years of radon exposure. Smoking history, persistent cough, coughing up blood, unexplained weight loss, chest pain, increasing shortness of breath. For people at high risk of lung cancer, such as certain current or former smokers, meeting age and smoking history criteria, your provider may recommend annual low-dose CT screening. Radon exposure alone does not automatically qualify someone for screening, but it is an important part of your overall risk profile. What they're going to do is scan your lungs to see if there's any scarring. We don't want any bronchial inflammation. We don't want bronchiolitis. We're trying to prevent, so they would do a CT scan with a little bit of barium to see if you can see anything. Now, what do we learn today? Radon is a naturally occurring radioactive gas found in the soil from uranium. Iowa has the highest indoor radon levels in the United States. Radon exposure usually causes no symptoms but can increase the risk of lung cancer over many years. Every home should be tested because radon levels vary from home to home. High radon levels can often be reduced with a professional installed mitigation system. The best way to protect your lungs is to reduce radon exposure. Avoid smoking and vaping. Stay active and maintain a nutrition-rich diet. Remember, the good news is that radon is one of the few major lung cancer risks that you can measure and fix in your home. It is a huge pleasure to bring this health into your hands. Thank you and God bless. and I'll see you next video.